Assalamu alaikum. I am Dr. Nishat, Assistant Professor of Department of Physiology, and today I will be continuing my lecture on gastrointestinal physiology. As I have mentioned in the last session about the differences between the myonteric and the submucosal plexus, today I will be continuing my lecture with the picture showing the location of the myonteric plexus and the submucosal plexus. This is the picture showing the location of the myonteric plexus, which is in between the longitudinal and the smooth muscle, and the submucosal plexus, which is in between the submucosal layer. What would happen if the enteric nervous system isn't functioning properly? It would cause Hirschsprung's disease. It is a developmental disorder which is characterized by the absence of ganglia in the distal colon, resulting in a functional obstruction. It's present usually since birth and may present with abdominal distension, constipation, and vomiting. Types of neurotransmitters which are secreted by the enteric neurons. It mainly secretes acetylcholine, norepinephrine. Others include adenosine triphosphate, cholecystokinin, vasoactive intestinal polypeptide, serotonin, dopamine, substance P, somatostatin, leuenkephalin, metenkephalin, and bombacine. Autonomic control of the gastrointestinal tract. It consists of the sympathetic and the parasympathetic supply. The sympathetic supply fibers arises from thoracic 5 to lumbar 2 segment of the spinal cord. It enters the sympathetic chain and then through the celiac and the mesenteric ganglia it spreads to all parts of the gut. And the neurotransmitter it releases is the norepinephrine, and main function is it decreases the activity of the enteric nervous system, that is decrease in gut movement but increase sphincter muscle contraction, decreases GI secretion, and lastly vasoconstriction. The parasympathetic supply. From mouth to the pharyngeal region, it is supplied by the facial and the glossopharyngeal nerves. In case of esophagus, stomach, pancreas, small intestine, and the first half of the large intestine is supplied by the vagus nerve. In the distal half of the large intestine up to the anus, it is supplied by the pelvic nerve, that is sacral 2, 3, 4. The neurotransmitter it supplies is the acetylcholine, and the function of the parasympathetic supply usually increases the activity of the enteric nervous system, that is increase in gastrointestinal secretion, increase in gut motility, and it also causes defecation reflex. Classification of local hormones of the gut. On the basis of the structural and functional similarity, they classified into three, that is the gastrin family, secretin family, and other polypeptides. The gastrin family mainly includes the gastrin hormone and the cholecystokinin, and the secretin family includes secretin, glucagon, vasoactive intestinal polypeptide, gastric inhibitory polypeptide. Others include mortellin, somatostatin, substance P, GRP, guanylin, and bombacine. This is the table showing the function and where it's being released and what is the main stimulus. In case of gastrin, it's secreted from the G cells of the antrum, duodenum, and the jejunum when there's protein in the antrum or in the duodenum, or there's any type of distension, or there's activation of the nerve. And the main function of the gastrin hormone is gastric acid secretion and mucosal growth. Cholecystokinin is released when there's protein, fat, and acid chyme in the duodenum. It stimulates the eye cells of the duodenum, jejunum, and ileum to release cholecystokinin, and it stimulates pancreatic enzyme secretion, pancreatic bicarbonate secretion, gallbladder contraction, and growth of the exocrine pancreas. Cholecystokinin inhibits gastric emptying. In case of secretin, it is released when there is acid and fat in the duodenum, and the secretin is released by the S cells of the duodenum, jejunum, and ileum. The secretin stimulates pepsin secretion, pancreatic bicarbonate secretion, biliary bicarbonate secretion, growth of the exocrine pancreas, and inhibits gastric acid secretion. Gastric inhibitory peptide, it's secreted mainly by the K cells of the duodenum and the jejunum, and it stimulates insulin release and inhibits gastric acid secretion. Mortellin, and it's released by the M cells of the duodenum and the jejunum. It mainly stimulates gastric motility and intestinal motility. What are the factors that affects the gastrin secretion? Stimuli that increases gastrin secretion are luminal factors, that is distension and presence of peptides and amino acids, some neuronal factors which includes increased vagal discharge, and some blood-borne factors which includes calcium and epinephrine. And stimuli that inhibit gastrin secretion includes luminal factor, that includes acid and somatostatin, and blood-borne factors include secretin, GIP, VIP, glucagon and calcitonin. Stimuli that increases cholecystokinin secretion, increased contact of the intestinal mucosa with the product of digestion of fat and protein, that is peptides, amino acid and fatty acids. Cholecystokinin enhances the action of secretin by increase in alkaline-rich secretion of pancreatic juice, inhibits gastric emptying and contraction of the pyloric sphincter, increases the motility of the small intestine and colon. Coming to gastrointestinal reflexes. There are three types of gastrointestinal reflexes. Number one, reflexes that are integrated within the gut wall entering nervous system. Example is the gastrointestinal secretion, peristalsis, mixing contraction and local inhibitory effects. Number two is reflexes from the gut to the prevertebral sympathetic ganglia and then back to the gastrointestinal tract. Example, gastrocolic reflexes, that is signals which are originating from the stomach which causes evacuation of the colon. Enterogastric reflex, that is signals that are originating from the colon and small intestine which send impulses to inhibit stomach motility and stomach secretion. Colono-ileal reflexes, reflexes from the colon to inhibit emptying of the ileal content into the colon. Lastly, reflexes from the gut to the spinal cord or brainstem and then back to the gastrointestinal tract. Example, reflexes from the stomach and duodenum to the brainstem and back to the stomach by the vagus nerve to control gastric motility and sensory activities. Pain reflexes causes general inhibition of entire gastrointestinal tract, and defecation reflexes, which includes travels from the colon and rectum to the spinal cord and back again to produce powerful colonic, rectal and abdominal contraction which are required for defecation. That's all for today. Thank you.